There is a need for better mental health support for teens that belong to marginalized groups, like Black, Indigenous, and people of color, also known as BIPOC, as well as other groups. These communities face many barriers to treatment. For example, research shows BIPOC teens are less likely to receive treatment for their depression. Individuals, families, and communities can all work together to support and address BIPOC and other groups' teen mental health needs and help reduce these mental health inequities. Here are some ways we can support the teen mental health of marginalized groups. Increase BIPOC mental health staff. Youth are 6 times more likely to receive mental health care in schools compared to other community settings. Community settings, such as schools, need to hire more mental health professionals, such as social workers and counselors of color. Increase training. Schools and other community resources staff should receive more mental health training to help them recognize mental health symptoms. Research indicates that many BIPOC community members, especially Black students, experience higher rates of misdiagnoses and receive discipline measures instead of treatment for mental health conditions. Therefore, it is also important that people receive training in more culturally responsive care that addresses the needs of the BIPOC community. Invest in mental health support. We need to invest in and prioritize mental health support. As adults, we should practice good mental health care ourselves to serve as role models for teen youth. We also should offer more mental health education, programs, and easily accessible services. Build community and peer relationships in teens. Peer relationships and programs should be increased. Research shows that youth rely more heavily on their peers for support. Social support can also help build coping and problem-solving skills. Increase resources and funding to address BIPOC mental health barriers. Many teens within the BIPOC and other marginalized groups may face mental health barriers such as language, limited health insurance, poverty, and trauma. Increasing resources can expand their access to proper care. These resources can include access to multilingual and diverse staff, trauma-informed and culturally responsive care, support resources for migrants, social services, and funding to address family economic instability. These are some of the BIPOC mental health needs, and this is not an exhaustive list of all BIPOC teen mental health treatment barriers and solutions. There is still and will continue to be work that needs to be done, but with some changes and collective effort, BIPOC teens can have the resources and support to improve their mental health. However, there is hope and communities that cater specifically to the BIPOC community. If you or someone you know is experiencing mental health symptoms, you can learn more about treatment options by visiting afsp.org/treatment. If you're a behavioral health provider seeking information on evidence-based treatment, check out our multimedia solutions for continuing education and shareable client resources at psychhub.com.